Okay, as I'm entering the room, I have my mask on. I'm going to do 20 seconds of hand hygiene. Hi, my name is Cath. I'm going to be your nurse for today, and we're going to be inserting your urinary catheter. Have you had this procedure done for you before? You haven't? Okay, that's all right. I'm just going to be verbalizing and instructing what I'm going to be doing as I go along the procedure. So before we get started, can I get your full name and date of birth? Okay, Donna Santiago, January 9, 2003. Okay, I'm just going to double check your wristband to make sure everything's correct. Give me a second. Okay. I'm going to scan your wristband. Okay, I see everything matches as well. And I don't see an allergy wristband. Do you have any allergies, Miss Santiago? No allergies? Okay, are you feeling any pain today? No pain? Okay, awesome. So I'm going to tell you what we're doing for the procedure today. So what I'm going to be doing, I understand that you have discomfort in your bladder and you're unable to urinate. That's why we're inserting the catheter. As we insert it, I'm just going to be cleaning your genital area at first. And then after that, I'm going to be inserting the catheter. I'm going to inflate it with saline to make sure it stays in place. Then I'm going to attach it to a stat lock and make sure that stat lock stays there. It's going to go in your thigh just so that you have more mobility if you need to move around. After that, I'm going to take a urine sample from you and I'm going to send it to the lab. So the lab can do any tests necessary for your urine. Then after that, the procedure should be done. This should be a fairly painless procedure. You might feel a little discomfort though. Other than that, it should be okay. Do you have any questions for me before I move on? No questions? Perfect. Okay. I'm going to close your curtain and for privacy, and then I'm going to lower your bed to a supine position. It already is, so we're good to go. Okay, I'm going to do hand hygiene for 20 seconds. I'm going to put some gloves on. And before I get started with the procedure, I just have to clean the table so that I can put my materials onto the table, right? Okay, I'm going to leave this here for now. I'm going to clean the table for at least 30 seconds. Ms. Santiago, have you had a good time in the hospital so far? You have? Good. And have any family visited? They have? That's awesome to hear. Okay. Table is clean for 30 seconds. I'm going to let that air dry for 2 minutes. And then I'm just going to take my gloves off. Okay, it's air dry. I'm going to put this back on. We'll do hand sanitization for 2 minutes. Or for 30 seconds. I'm going to put some gloves on. Okay, Ms. Santiago, I'm gonna start cleaning your genital area. I'm gonna have to lift up your blanket. Is that okay? Okay, thank you very much. Okay, I'm not gonna lift your gown just yet, but I'm just gonna position you first. So I'm gonna have you sit in a froggy position. I need your legs bent. So I'm gonna have both legs like this. Thank you, Ms. Santiago. Okay. I have a warming blanket since I'm going to have to review your genital area for quite a while during this procedure. I just want to keep you warm, so I have a warming blanket for you. Okay, I'm going to put some chucks for you. Oh, right, before that, I'm going to have to lift your gown up. Is that okay? Thank you, Miss Santiago. Alright, I have your chucks here. Let's put it right under your genital area. Okay. Alright, I'm just going to clean your genital area now. Take one wipe in the middle, one wipe on the side, and one wipe on the other side. Okay? Just going to lower your gown for now, just so you don't get cold. Okay? I don't need the wipes anymore. I'm going to take off my gloves. Hand hygiene for 20 seconds. Okay. New gloves. Ms. Santiago, I need to prepare my kit so that I can get the materials ready. On my Holy Catheter kit, I have my syringe for urine collection, an alcohol pad, and my stat lock. Okay. Make sure I don't touch the sterile area. Santiago, I'm just going to put a drape right underneath you. And make sure I only touch the 1-inch border. Okay. And my sterile gloves. Okay. I'm just going to readjust this a little bit. There we go. Okay. I'm going to put in the syringe. The stat lock. Okay, and my alcohol wipe. Make sure I don't touch it. Okay, I'm going to dispose of my gloves. Oh, I took one glove off, but one glove. I'm just going to take one glove. I'm going to lift your gown up, okay? Thank you, Ms. Santiago. There we go. Okay, remove the rest of my gloves. Hand hygiene for 20 seconds. Okay, now I'm going to put my sterile gloves on. I'm going to dispose of this. Okay. Alright, I'm going to start preparing the kit. Take the lubricant out, the alcohol, or the iodine swabs out. I'm going to take this urine sample bottle. I'm going to twist it. I'm going to leave it over here. And this sterile saline, I'm going to leave it right here for now. Dispose of this. Okay. I'm going to take the orange port here. I'm going to connect it to the saline. Dispose of this. Okay, I'm going to take the sheet off. I'm going to put the lubricant on. Put the iodine right here. Okay, everything looks good. I'm going to bring the kit over here for you, Ms. Santiago. All right, Ms. Santiago, I'm going to start with the cleaning. So I'm going to take my non-dominant hand. I'm going to open your vulva right here. All right, I'm going to take the swabs. I'm going to be cleaning. So first, I'm going to clean the middle, the side, and then the other side. Okay, I'm going to dispose of the iodine package as well. Okay, Ms. Santiago, I'm ready to put the urine catheter in. So what I'm going to have you do, I'm going to have you inhale, and then I'm going to have you on when I count to 3, I'm going to have you exhale as I insert the catheter, okay? So take a deep breath. Okay, 1, 2, 3. Okay, I see urine flashback. Okay, I'm going to go 1 to 2 inches deeper. All right. Okay, I'm going to stabilize this catheter right here. I'm going to inflate the balloon with saline. Are you feeling okay, Miss Santiago? Okay, you are. Okay, I'm going to leave the syringe here in case I still need it. Okay, I'm going to test for resistance. Okay, there is resistance. Good. Okay, I'm going to let go now. I'm going to dispose of this. Don't need the lubricants either. Okay. Next thing I'm going to do, I'm going to take a urine sample. Okay. I'm going to, for that I need to take the CHG wipe. I need to hold it like a taco. Need to clean it for 5 seconds. Clean the hub. 1, 2, 3, 4, 5. Then let it air dry for 5 seconds. Then I can take my syringe and I can put it on. I'm gonna take about 5 to 10 milliliters of urine. Okay. I'm gonna put it in the bottle later. Okay. I'm gonna take the stat lock. Well, first I'm gonna take the skin protectant. Clean the surrounding skin on your thigh. Dispose of this. I'm gonna take the stat lock. Here, I'm going to attach your catheter. Or actually, You feeling okay, Miss Santiago? Okay, sounds good. Okay, that should be on. Okay, we're almost done with Santiago. I'm just going to attach this to the side of the bed. Make sure it's not on the railing. Okay. All right, I'm going to dispose of the box since we're done. Okay, I'm going to dispose of the drape as well. Okay, I'm just going to lower your gown to maintain your privacy. Okay. Yep, should be done. So I'm going to lower your blanket as well. Feeling okay with Santiago? Any pain? No pain? Okay, awesome. I'm dispose of my gloves. 20 seconds of hand hygiene. Okay, and then I'm going to put another pair of gloves to get my urine sample. And Santiago, I'm just getting this urine sample so that I can bring it to the lab to make a urinalysis in your urine. Open this carefully, make sure I don't touch these sides. Put the urine in. Okay, there you go. Excuse me, I'm going to dispose of that. Put this in. Okay, make sure I label the patient's full name and date of birth. I'm going to label the date and time of the procedure and the patient's MRI number. Leave it to the side, and I'm going to dispose the rest of this. Okay, I'll leave this for later. Okay, Ms. Santiago, the procedure is done. Do you have any questions or concerns for me? No questions, concerns? Okay, let's do the 20 seconds of hand hygiene. All right, the procedure should be done. You have no questions, so that's good. You didn't feel any pain, right? No pain? Okay. Feel like you tolerated the procedure well? Yes? Okay, perfect. I'm going to lower your bed to lowest position, put the side rails up, and have the call bell right next to you in case you need me or any of the nurses. Other than that, we are done. You can keep the warm blanket if you want, and then I'm going to go out and I'm going to document the procedure, all right? Thank you, Ms. Santiago. Okay, I'm going to document the date and time procedure, patient's tolerance and pain level. A urine output was 150 milliliters on the bag, and then the catheter size was 16. Urine characteristics was yellow, clear, I had no sediment, and that's it.